Since 2016, there has been over 40,000 Canadians that have died from opioids. To think about that another way, imagine an NHL arena full of people. Well, it would be the equivalent of two NHL arenas full of people. Needless to say, this is a big problem here in Canada. Today, we're going to unpack this issue. We're chatting with Adam Zivo, who is the director for the Center for Responsible Drug Policy. Adam, thanks for taking a few minutes to help us learn more about what's happening with this issue and some of the approaches that governments are taking to deal with it. I'm wondering if you could just start off by telling us, could you give us a quick explanation? What's the difference between an opioid and fentanyl? Because we often hear these two terms in the same breath.
Well, so an opioid is a kind of medication which is used to manage pain, but if used in excess, can cause intense euphoria. So an opioid is not the same, for example, as the Advil that you keep in your medicine cabinet. In fact, for most of history, when opioids were available, they were reserved for really serious pain cases, for example, cancer patients who were on the verge of death. But then they became much more normalized in the late 90s, which then created the addiction crisis that we see today, because opioids are highly addictive and you develop a tolerance to them quite easily, which means that you have to keep on using more and more and more to get the same effect. Now, fentanyl is a type of opioid, and it's basically in the same family as heroin, but it's about 10 to 50 times stronger. So heroin and fentanyl are both opioids. And then on top of fentanyl, you have different versions of fentanyl that are even stronger, like carfentanil or sufentanil.
And how did we get to this point where there's suddenly this explosion of people becoming addicted to opioids, but also dying from them?
Well, it all goes back to the late 90s. So there was this predatory pharmaceutical company known as Purdue Pharma, and essentially they created a new long-acting opioid called OxyContin. And they marketed it as safe and said that it was non-addictive, but that was false. And they actually misrepresented scientific research to make that claim. Then they used sales reps to aggressively market, say, OxyContin to doctors all throughout North America, resulting in widespread overprescribing. And then this OxyContin was then widely resold on the black market, even though it was a quote unquote safe pharmaceutical opioid. And it caused people to get addicted. You had patients who would, for example, get a small injury, then they were prescribed opioids quite liberally. Then one OxyContin wouldn't be enough. They started to up their dose. And then over time, they ended up switching to heroin because the OxyContin wasn't just doing it for them anymore. And by the early 2010s, we had that crisis that we see today, which just still continues.
And so if we think about the demand side a bit further, is part of the problem that you have people, I'll say, needing this in the first place? I mean, often we do a lot of work on healthcare, and there's so many cases where people are being told they have to wait a year, 2 years for surgery. They're waiting in chronic pain, and they're being prescribed painkillers. Is that part of the problem, or is that separate from, in your mind, what we're talking about here today with opioids?
It is connected to the problem. So there are some pain patients who legitimately need opioids to manage their pain and to live comfortably. There are also many pain patients who would benefit from other treatment modalities such as physiotherapy. But these other treatment modalities are very expensive and they take a lot of time. And our government doesn't always want to invest into that. So the cheaper and easier option is just to throw people drugs, which then creates the risk of them getting addicted, which is what happened with many people. However, since the OxyContin crisis, Canada has really clamped down on prescribing opioids for pain management, but it hasn't invested into those other forms of pain treatment. So what that means is that you have a pool of people who are in deep and chronic pain who cannot get the physiotherapy that they need, but they cannot access the legal opioids that they need. And so they often turn to the black market instead and then become illegal drug users.
And so when you think about this issue across the country, where is it the worst?
Oh, I mean, obviously, Vancouver for a variety of reasons. Uh, Homeless
Mhm.
people and drug addicted people tend to go to Vancouver because the climate is more temperate, and the city has always had a policy environment that's been very conducive to addiction, always kind of enabling people for the past 20 years. So everything is concentrated there, although that doesn't mean it's not present in other places.
Okay, and when we come back, I want to start chatting with you about safe supply. We hear this term all the time. I want to get your thoughts on how it's working or not working. We'll be back in just a few minutes.